Are back with another Ask the Pediatrician segment, and today we're tackling pediatric brain tumors. Joining us is Dr. Bhardwaj, a pediatric neurosurgeon at the Palm Beach Children's Hospital. Thank you so much for coming in. I know you've been pretty busy. Let's start with this. How common are brain tumors in kids?
Pleasure being here, Holly. It's a great question. For parents of a child with a brain tumor, it's way too common. It's pretty sporadic. We see them every now and then, but it's kind of good now we're here. We can take care of these kids locally when they do pop up.
I know there's probably so many factors that go into it, but are there any type of warning signs or things that parents maybe can look for that something's not quite right?
That's a great question too. So if they're vomiting, if they're sleepy, funny eye movements, sometimes it can be a new onset seizure. You know, if your child is just acting abnormally, it's always good to get them checked up with a pediatrician. I
know at Palm Beach Children's Hospital, you guys have some technological advancements that are really helping you all out and treating your patients. Tell me more.
It's an exciting time to be in medicine. We have new platforms that are allowing us to really look into a child's brain to plan a surgery as safely as we can. We're able to see the anatomy much better, make beautiful trajectories, kind of understand how to get in and out of a child's brain very safely. And you know, whether it's a microscope or our new Brain Lab platform that allows us to see white matter differentiation and kind of complex anatomy, personalized to the child's own MR, this is all here and now. It's akin to having great maps and making a great trip.
Looking at some video here of you all at work, so I've got to imagine with this technology, the success rate for removing these brain tumors, what, it's tripled?
I wouldn't put a number on it, but we can do it far more safely. Somebody saw me planning on the other day in the flat screen, and they said it was kind of like from Iron Man when they were making stuff. You can see such better fidelity and anatomy, and it just makes the trip of an operation that much safer. And when you go into a child's brain, anything helps.
Sure.
And this has been pretty fantastic.
Definitely got to give you more confidence in what you're doing.
Absolutely. You know, we have a pretty good idea of what we're doing when we get in there, but it's kind of if your car's better, your maps are better, your planning's better, you know, you've got a much better chance for a successful trip or operation in this case.
Well, like you said, one case is too many, especially for the parents who have to live through this. So.
And if it happens, then we're here, and you know, I tell the parents this is the first time they're hearing this news, but if we have to break it, this is something that we do every day because we're good at it and we want to help the children locally. So, you know, it's much better to meet me in the supermarket, but if it's not, then we're here and happy to help.
Absolutely. Doc, thanks so much for educating us on brain tumors. We appreciate it. Have a good day.
Thank you.